Good morning. Thank you, Mr. Chairman, Secretaries, Physician General. Thank you so much for joining us. In reviewing the tracking run, and I'm going to pull up Department of Health because it has larger line items, I pulled out kind of real cuts versus merger shifts. In this, it looks like a lot of your budget is just merged into the new Health and Human Services Department. Outside of state health care centers, community-based subsidy, which is eliminated, regional cancer institutes, which is eliminated. So outside of things that are eliminated, can you explain how any of your appropriations are actually reduced, finding cost savings moving forward that actually is implemented within the merger? Because based on what I'm seeing, there's no real changes whatsoever outside of the state healthcare centers, which you could be reducing out without having to do a merger.
Thank you. That's a great question. There is $9 million accounted for, I believe, for cost savings with the consolidation. I would also, as you mentioned, the state health centers are significantly being reduced, and I'm sure we'll get to talk about that later. But I think we are really committed to making a difference with this consolidation. And while it is a very difficult budget year, and we've made decisions that are based on the challenges that we face, the fiscal challenges that we face. The governor's goal of this consolidation isn't only limited to savings. The goal of the consolidation is really to improve the service that we offer Pennsylvanians.
So here's the problem with that. DHS is the single largest state agency in the entire Commonwealth. I question whether it is manageable to begin with, and that's coming from a person who represented the former secretary of that department, who had many conversations on it. You're now merging 3 departments in with that singular department. There are no reductions in GGOs. Based on the analysis I've seen, I haven't seen any streamlining of any government entity within those. You're just taking the departments, slapping them together, throwing on a new name, and honestly, what's the $9 million of savings from? What is that as a result of?
Well, you're eliminating 3 cabinet secretary positions and all of the associated expenses that go along with those management positions. There is also some management eliminations included in that $9 million, and it would be recurring. I also would say that you correctly point out that it is a large agency. It's a super agency. We are committed, and the 4 secretaries are committed to working to develop a consolidation plan that is better for Pennsylvanians, and we're not consolidating for the sake of consolidation. I would also just like to add, I think the importance of leadership and execution of this strategy is critical. I think that to be big for the sake of being big it doesn't make any sense, but we've also seen very large programs run very efficiently in other states and also in the federal government when leadership and execution is there. And I can tell you that we are all committed, the 4 secretaries are very committed to developing a successful execution plan that will improve the service for Pennsylvanians.
As far as your execution plan, this is going to start June 30th, July 1st, that time frame, and it'll be a merged department from there on after. Is that your time frame of execution?
Yes.
I know larger companies with smaller mergers that have taken years to merge and merge appropriately. How do you, with the amount of services that these agencies do, with union contracts, with everything that's you're dealing with within these agencies, how do you plan on effectively doing that in a few months?
And I would agree with you in terms of, and perhaps I used the wrong term in saying full execution. We will begin the organization. We will work from now until then, until July 1st, at building this organization. I do believe that the improvements in service and that the department as a whole will be an evolution. I don't think that I think you're right. We don't turn a switch on July 1st and all of the programs are placed together and we're running at, excuse me, at optimal efficiency. I do believe we can work and work in a fashion that the strategy develops as we move forward, and that the services can be improved, and we will have a more rational way of rendering the service for Pennsylvanians.
Thank you. I see my time's up. Thank you. Thank you, Mr. Chairman.
Thank you.